In this presentation, we will be discussing obesity as a chronic illness. Obesity is defined as the accumulation of excessive body fat. As a result of this fatty tissue, the body is more susceptible to serious illnesses. We will discuss a few of these serious illnesses later in the presentation. Obesity is generally diagnosed by the calculation of an individual's BMI and waist circumference. Terms I searched for this presentation were managing obesity and obesity support. The reason I used those search terms was because I wanted to find the best outcomes for obesity treatment. Not only the physical outcomes, but also the emotional and social health involved in the treatment of the individual. Revising diet is the best form of acute weight loss. According to most supported research, a low-fat or moderate fat, low carbs, low sugar, and high protein and Mediterranean diets had the most successful weight loss results. Additional studies have shown, however, the weight loss is difficult to maintain without implementation of physical activity. Researchers suggest that 1 hour of moderate activity on most days, such as brisk walking, is needed to prevent weight regain. Drug therapy is indicated in conjunction to diet and physical activity. FDA-approved drugs work by increasing satiety and inhibiting hunger effect. These drugs include lorcaserin, fen-TPM, and bupropion. Surgery is another option briefly mentioned in this article. It's usually limited, however, to severe cases, especially in conjunction with uncontrolled diabetes mellitus. The second WebQuest article was a study aimed to explore the experiences of patients with obesity in healthcare, as well as their perceptions of the support they received. There were 4 levels of support in which patients described their experiences, with 1 being the worst support and 4 being beneficial support. Only 14% of subjects reported beneficial support in regards to obesity. In addition, many of the subjects mentioned confusion at the implications of obesity. Their healthcare providers had never explained to them the health effects that obesity has on the body. Almost all of the participants in the study emphasized that an expectation of negative stereotypes. It wasn't that they had experienced social stigma, it was that they expected it. This expectation was present even upon entering health services. Thirdly, many individuals with obesity are indeed aware of their problem, and the topic they feel has been exhausted by their doctors. In fact, they feel as if their doctors do not take them seriously and attribute all their problems to the individual's weight. When asked, many of the participants felt that the best way to improve the treatment of obesity was to encourage group support. This kind of support, however, is best received if encouraged and facilitated by primary health care. Living with obesity. This video, Effective Obesity Management, is a very informative clip portraying a few of the difficulties faced by individuals with obesity. The video is only 3 minutes long and is definitely worth all of your time. According to Dr. Wharton, obesity is a neurological and hormonal condition. Due to a lack of this understanding, however, there are obvious social and employment discriminations against such individuals. Dr. Wharton suggests that the term obese should never be used as a noun. Instead of saying, that person is obese, it should be phrased, that person has obesity or is suffering from obesity. The major health risks associated with obesity are diabetes, hypertension, and sleep apnea. Treatments include diet, activity, medications, and surgery. Similarities between the 3 articles were increasing prevalence. 35.8% of Americans in today's culture are obese. All of the articles mentioned that there are more and more people becoming obese. In addition, all of the articles included treatment regimens of diet and exercise as being foundational to losing weight. A few differences portrayed were social stigma, location, and drug treatment. Though social stigma was emphasized in this presentation, the first web quest of this PowerPoint avoided the subject completely. Unlike the advice of Dr. Wharton, this article presented obesity as a tragic disease, but left out the feelings of the patients completely. It emphasized unfortunate statistics and left the reader feeling depressed. If I, as the reader, felt depressed, I am certain that when an individual with obesity reads this article, they will feel frustrated and hopeless. Things that are common but often avoidable with chronic illnesses. Another difference was the varying locations from which the information was given. The information from the first slide was an American article from Colorado. The second article was derived from the United Kingdom, and the third slide, with the information gathered from the video, was from Canada. Though obesity is a prevalent problem in many parts of the world, this difference needs to be noted and taken into consideration. The third difference was the varying information given on drug treatment. While Holly Wyatt from the first article emphasized medications enabled to obtain weight loss with severe obesity, Brown, Thompson, Todd, and Jones from the second article did not mention it. They relied on support groups for effective weight loss. Additional information. The cost of obesity is staggering. In the United States, the cost of obesity ranges from $3.3 to $6.3 billion annually. This is surpassed in Canada by $4.6 to $7.1 billion. In the United Kingdom, the average is $1.4 billion annually. In closing, we need to remember that obesity is a chronic illness. Because it is a medical condition, obesity must be taken seriously and treated properly. There should be extra effort put forth in the treatment of obesity, as it puts the patient at great risk for further chronic illnesses. Take note that treatment of obesity does not always indicate medical treatment, as diet and physical activity are more important in obesity. Not only must we negate personal social stigmas, all healthcare professionals should take it a step further and avoid any statement that could in any way be misinterpreted as a bias against them. As previously mentioned, most patients with obesity expect social stigmas. Great lengths must be taken by us to avoid this. Also, stigmas are not limited to the healthcare realm. We should not only avoid appearing biased at our workplaces, but also in our personal lives. Patients with obesity are often judged by strangers, their friends, and even their own family. This affects all of us. Let us not be the ones who are adding stress to these individuals. They carry enough of stress already. And I have some references. Thank you for listening to this presentation, and I hope that you learned a lot.